Okay. So earlier numbers I gave is total health expenditure.
This one is the hospitalization.
As in terms of hospitalization, for DOH hospitals, the coverage of PhilHealth currently, is this correct?
64%.
Is 64%, but the goal is
100.
100. So the support won't be coming from DOH but directly from PhilHealth.
Forward.
Is that correct? Okay. So anyway, it's 64% and the goal is 100% in basic accommodations. And then for the LGU hospitals, PhilHealth
90%.
is currently paying 90%, Mr. President.
How about the private hospitals?
Kasama na yung basic for private LGU. It's 80.
Sa baba po. Maliit pa po. 26.
26.
Oo. So sa private, there's the private beds, they cover 26%, and for the ward beds, it's 36%.
For private hospital.
So
Private hospitals, yun, Mr.
That's the
President.
private hospitals.
Yes.
So can we say that hopefully by next year we will, since the Senate, through the intervention of this committee, has added so much, no, for PhilHealth for next year, can we expect that that PhilHealth will try to at least increase the participation, considering that we have added about 100 billion, including the 60 billion that we returned, so that ito, sana naman maramdaman na ito ng ating makabayad. Of course, fellow health advocates like you would want to see the out-of-pocket expense of every Filipino to at least be lowered next year.
Yes, Mr. President. That will really happen with the benefit expansion package. Did I say it correctly?
Yes.
And then also the DRG, the diagnosis-related group, where, as I mentioned in one of the interpellations earlier, would be a shift from case rate to the DRGs, and that would have different rates, more rates compared to the case rate where it only has two. Yeah, based on the complexity of the disease, and it will also include the social demographics of the patient, and like I said, the complication of the particular ailment of the patient.
And likewise, for the record, based on our Senate committee report, PhilHealth will receive a 113 billion subsidy for 2026. This is 60 billion pesos higher than the NEP recommended budget.
60 because
But we all know that the 60 billion is actually PhilHealth's fund. But nevertheless, we health advocates in the Senate, including the sponsor, my co-authors in the UHCR here, this is the intervention that we had. No, we increased by almost 60 billion from what is recommended in NEP. And I'm hoping that, sabi ko, siguro naman natuto na tayo and na hindi na gagawing savings ang pondong to, no? And we have that commitment from Dr. Mercado that this one, sabi ko, public funds, dapat to nararamdaman at ginagamit, hindi ginagawang savings tulad nung nakaraan. Do we have that commitment from Dr. Mercado and PhilHealth?
Yes, Mr. President, but just to add, as His Honor was saying, 60 billion was added in the GAB, in the House version, which the Senate also carried. But this representation was pushing for an additional 16 billion. Yung utang pa po dun sa kulang sa 60 billion. Kulang yon for that's the 2025 collection that should have been delivered in 2026. So yan pa rin ho ang standing appeal natin sa Finance Committee na i-consider sana ito, because the funding has been earmarked, has been collected. It is in the National Treasury, Mr. President. So there is no basis in law to deprive PhilHealth of that funding, because we created a law that would deliver that funding. So let the record show that His Honor Senator JV is nodding his head because siya nga ang author ng batas na to, nagsasabing ganyan ang collection natin. There is no ifs, there's no buts, there's no hindi nga when able because that amount is certified by law. So nandyan na yan. So anyway, I'm preaching to the choir, Mr. President, but we need to put it on record para sana may pag-asa pang masama.
I'd like to thank the sponsor, no, for really pushing for that. And tama kayo, that's earmarked, no reason for
You cannot say that there's no funds
Yeah.
because the funds exist. And if it's
It has
in the
been
national,
collected.
it has been collected. So if it is in the national treasury, does it mean it's going to be used for something else? There's no basis for it to be used for something else. And idagdag na rin natin, over the years, there's also the PAGCOR and the PCSO collection of 106 billion from 2019 to 2025 that has also been collected. And they are citing the phrase subject to accounting, budgeting, auditing. Gaano katagal ba kailangan ayusin yung accounting, budgeting, auditing para lang makuha ng PhilHealth? Kahit nasabi mong, sige, sinecheck pa nila yung accounting, auditing, di kahit kalahati, i-advance nyo na sana. So actually, Mr. President, pag nakolekto, almost 300 billion ang mapupunta sa PhilHealth. Sa akin, dapat lang na amount yun. The people will feel it after all the pain that the Filipinos have had to endure seeing the anomalies with these flood control projects, di ba? Pag nakita nila na, talaga palang, pati nga yung LGU, pag pumunta ka sa LGU hospital, covered na, ito, may pagkukunan naman na pondo kasi it is already earmarked by law for PhilHealth, Mr. President.
Yes, Mr. President, we thank the good sponsor and we fully support the push for additional subsidy for PhilHealth. Funding is crucial for the full implementation of UHC. In the first place, you are correct. Those are earmarked funds and this came from sin taxes that have been collected already. Wala na rason para i-hold pa nila eh. It should be given at talagang dapat mapakanabangan na.
Actually, Mr. President, if I may add, because at the proper time in the committee amendment, I intend to raise this. Parang narinig ko, I'm not sure if it's from DOF Secretary, former Secretary, Secretary Ralph, or somebody else, no? Pero sabi, well, there's nothing that prevents the legislators from saying otherwise. First of all, I don't agree because the GAA is a general law. It cannot overturn a specific law like the syntax law, the UHC law. But having said that, let us make our position clear that hindi naman tayo pumapayag na ganun yung nangyari at ibalik natin yung pondo. That is something we are capable of doing, Mr. President.
Yes, we will support you and we will work on that. No,
Thank
your
you,
fellow
thank you.
health advocates are here on the floor right now. Mr. President, under the Universal Healthcare Law, every Filipino shall be granted immediate eligibility and access to mental health services. No, I want to go to mental health because I feel, Mr. President, Madam Sponsor, that mental health issue is a clear and present danger affecting a lot of our people, especially the youth right now. Marami hong suicide cases na, depression, and a lot of mental health issues that need to be given attention, no? Especially in this day and age of social media, prone to yung cyberbullying, hate, tapos kung may mental health pa, that will increase the risk, no, of yung mga nagsisuicide, those going to depression, and they really need help. And I had the chance to meet the National Center for Mental Health, and I'm glad to know that we have programs, no, and in fact, there are mental health medicines that are being distributed, and also yung mga counseling, meron tayong hotline, but I feel that it lacks the information drive, no? Siguro kailangan, I think doon tayo nagkukulang because yung a few minutes na mayroong matawagan yung mga mayroong parang mental health problems would save lives. Siguro yung hotline, if the sponsor would be supportive, I would propose an increase in budget para ma-improve yung hotline kasi sabi rin sa mga sinusubukan daw nila tawagan, even Kuya Kim, no? Yung kanya anak na sumubok, lagi daw busy. So siguro we can add more lines and more mga counsel, no, that can attend to yung mga and manpower, no, for the hotlines. If it's okay with the sponsor.
Yes, definitely, Mr. President. I need to get the confirmation from DOH. Can you add hotlines? Yes, you can do that. In fact, if I may add, you can be very clear na, let's just say for the sake of argument that you already have 100 let's say professionals, also whether it's a psychologist, a doctor who will actually pick up that call. But there's nothing that prevents you from having a layman who has been trained to be the initial responder. You can train them to respond to these situations and then wait for you have a human being on the phone with you and talking you through it and say, I will get a professional for you in 20 minutes, but stay on the phone with me, etc., etc. Pwede naman natin gawin yun.
May peer support group na.
Okay, so but itong peer support group nyo, are they on the hotlines?
LGUs.
Kaya nga, I'm talking about the hotline kasi yun yung question ng ating senator.
I was also-
The hotline, may peer group sila, they're pointing out to me that they have peer groups in the LGUs. I'm pointing out that you can make use of these peer groups or whoever else, right? You see my point? Okay, so clear tayo na para maging effective yung hotline, Mr. President. On that note also, we have increased their health promotion budget. For 2026, the health promotion budget is 261 million. And for me, Mr. President, since the cause, not of all, but of many mental health breakdowns, issues are online, then why don't you also have more professionals who are very good with communicating skills, who are comfortable, maraming ganun na, whether doctor yun or nurse yun, talking about it, what to do, how to access it on TikTok, kasi that's what depresses these people. So have somebody who will now step up and do the opposite. This is what you do. Let's do that. Can we see the results? Ako na, well, anyway, that's my personal opinion. That's not coming from them. That's my opinion. But do you agree? So when can we see this? By January, can we launch? Ang dami na, these are micro-influencers, ha? You don't even have to pay them. These are not celebrity endorsers that will demand a high price. In fact, many of them, kung advocacy na nila yun, they will even do that for you for free. But you might as well pay them something because number one, you have a budget. Number two, hanap buhay din naman nila yun. So, there. Okay?
Yes,
His
okay.
Honor agrees, yun na yun. If you
Yes,
want to
I
add
agree.
something.
Of course, kasi a few, that few minutes would matter. It may save lives. So, I was also told, sabi nga po nung National Center for Mental Health, some of their phones are even outdated. That's why I would like to propose na dagdagan natin, at least, if you can improve the communication lines, probably add some manpower, at least to be able to answer to those who are already seeking help.
Responded in the affirmative, Mr. President.
And likewise, there are medicines available, no? According to the National Center for Mental Health, for yung mga pang depression and other maintenance medicines. There is, Secretary Borosano is nodding his head, there is medicine available, but people do not know. Siguro yun lang ay probably improve the information campaign. Yung mga parang it's okay na to be okay, mga ganun ba? So that people would know that they can go to certain health facilities to get their maintenance medicines for mental health.
Actually, Mr. President, I know because I just saw this morning actually, I saw a very well done, I think it was a YouTube material coming from DOH on debunking all of these statements coming from different topic, my favorite topic, coming from the vaping community. So there was a female, I think she's a doctor, debunking all of their propaganda na it is not true. Ang ganda, simple lang, straight to the point. It is not true, yung sinasabi nilang healthier yan. It is not true, ganon. So it's on the DOH site. Ang sa akin, it has to also be on sites of micro-influencers. I don't know if that doctor has her own page and then i-share. Kasi kung DOH lang, the average person, even I, sorry to admit, I don't visit that site. And even if I visited it on purpose, I probably visit other sites more often that nawawala siya sa algorithm ko, hindi siya papasok. So you need these other influencers who literally nga influence the young people, the people who need to see it, to see that good piece of material that you were able to come out with.
Natutuwa rin tayo, no? That